What if the technique you have relied on for decades to maintain your sexual health is quietly starting to work against your body? Most men over 60 never receive formal guidance on how to adapt their habits as they age. Many continue doing what has always felt familiar, fast, firm, and focus solely on the end goal without realizing that the body itself has changed. As we age, tissues become more sensitive, blood flow dynamics shift, and nerve responsiveness declines. If you don't adjust your technique, what once provided pleasure can start to produce discomfort, frustration, and even long-term harm. The reality is that using the wrong technique can quietly damage circulation, reduce nerve sensitivity, and erode confidence more than many men recognize. It is not about failure, it is about biology and adaptation. Today, my goal is to provide you with practical, evidence-based guidance that allows you to care for your body safely while enhancing pleasure, comfort, and confidence well into your later years. I am Dr. Daniel Cross, a board-certified urologist, and for the past 22 years, I have dedicated my practice to supporting men over 60 in maintaining healthy, confident, and safe sexual lives. Throughout my career, I have observed that most older men struggle with adjusting their routines, largely because society rarely teaches men how to adapt to age-related changes. In this guide, I will take you step by step through how to adapt your self-touch routine in a way that respects your body, supports long-term sexual health, and enhances pleasure. The key is understanding the aging male body, the changes that occur, and how to make thoughtful adjustments that prioritize both safety and satisfaction. As men age, several systems that contribute to sexual response begin to shift. Testosterone, the hormone responsible for libido, mood, and sexual performance, gradually declines. While this does not mean that desire disappears entirely, it often becomes less spontaneous and requires more intention to experience fully. Blood flow also changes with age. The small blood vessels that supply the penis can become less elastic and efficient, making erections slower to develop and more difficult to sustain, particularly when you are alone or relaxed. These vascular changes are natural, but they necessitate modifications in approach. Furthermore, the nervous system also changes. Nerve endings that once reacted instantly may now transmit signals more slowly, so touch may feel muted and arousal may take longer to build. These combined factors mean that methods you used in your 20s, 30s, or 50s may no longer be effective or safe. Many men are unaware of these biological changes and assume that if they experience differences in sensation or response, something is wrong. Unfortunately, the most common response is to push harder, tighten the grip, and focus exclusively on achieving climax. While well-intentioned, this approach can be counterproductive after 60. Fast, firm, outcome-driven techniques can increase the risk of irritation, reduce nerve sensitivity, impair circulation, and create frustration and stress. The first step toward a healthier, safer routine is recognizing that adjustment is not failure. It is evolution. The body simply requires a new approach to achieve the same sense of satisfaction, comfort, and connection. Through my years of practice, I have identified 5 common mistakes older men make in their self-care routines, which quietly undermine sexual satisfaction. The first mistake is using the same grip strength you have always used. As the penile skin thins and becomes more delicate with age, a grip that was previously pleasurable may now feel irritating or even painful. Excessive pressure can damage small blood vessels and reduce the ability to achieve or maintain arousal. The solution is simple: experiment with a gentler, more mindful hold. Shift your focus from force to sensation, letting touch guide you rather than muscle memory alone. The second mistake is going too fast too soon. With age, the nervous system slows and rapid movements can overwhelm the brain, resulting in sensations that feel flat, confusing, or unfulfilling. To continue enjoying stimulation, it is essential to slow down and focus on steady, rhythmic movements. Think of your nervous system as a slightly out-of-tune radio. The music, the pleasurable signals, is still there, but it requires careful adjustment to hear clearly. By adopting a slower pace and allowing the brain time to process sensation fully, men can regain enjoyment and reduce the risk of overstimulation or discomfort. Mistake number 3 is neglecting lubrication. Many men assume that lubrication is unnecessary unless engaging with a partner, but this is a misconception. Declining testosterone reduces natural lubrication, and thinner, more sensitive skin increases the risk of friction-related irritation, microtears, or soreness. Using a gentle, unscented water-based lubricant at the start of self-care, rather than waiting until arousal is fully developed, softens the skin, reduces friction, and helps the nervous system interpret touch as pleasurable rather than stressful. Lubrication is not optional. It is an essential tool for maintaining skin health, improving comfort, and enhancing overall satisfaction. The fourth mistake is forcing oneself to climax. After 60, arousal often takes longer and may come in waves. Attempting to rush or pressure the body into orgasm can trigger stress hormones that suppress sexual response, reducing both pleasure and satisfaction. The goal should shift from a performance-oriented mindset to a connection-focused approach. Allow experiences to unfold naturally. Satisfaction may occur without climax, and it is perfectly acceptable to pause and return later. Redefining what constitutes a successful session can dramatically improve both physical comfort and emotional well-being. The fifth mistake is ignoring your body's signals. After decades of habitual routines, it is easy to operate on autopilot, repeating movements regardless of sensation. However, self-touch after 60 should prioritize response over repetition. Pay attention to what feels good, adjust what feels dull, and stop anything that causes discomfort. Focus on connection, not performance. Your body communicates differently as it ages, and listening carefully allows you to maximize pleasure while minimizing potential harm. Implementing a healthier, safer approach requires deliberate, structured steps. Begin by choosing a time for self-care when interruptions are unlikely, ideally 15 to 20 minutes. The nervous system functions optimally when it feels safe and unhurried. Next, prepare your environment. Dim lighting, soft background music, and comfortable surroundings help relax both mind and body, creating an optimal foundation for pleasure. Begin the session with slow, deep breathing. Inhale through the nose, exhale through the mouth. This signals safety to the nervous system, improves circulation, and enhances focus. Early application of lubricant is the next crucial step. Spread it gently over the entire genital area, allowing warmth and moisture to become part of the experience rather than a preparatory act. Explore slowly, like a therapeutic massage rather than a mechanical process. Experiment with pressure, rhythm, angles, and temperature. If arousal fades, pause without concern. Fluctuations are normal. Maintain deep, steady breathing throughout, which supports circulation, reduces tension, and allows for greater sensitivity. Positioning also plays a critical role in comfort and pleasure. Avoid compressing nerves or restricting blood flow by sitting on hard surfaces or hunching forward. Consider reclining with support, lying on your side, or elevating your legs with a pillow. Minor adjustments in posture can have significant impacts on arousal and sensation. Additionally, some men benefit from supportive aids, such as warming sleeves or textured tools, which provide enhanced sensation without excessive force. These tools, much like glasses or hearing aids, help the body adapt to changing needs rather than forcing it to conform to outdated habits. Mindset is equally essential. After 60, self-touch is not merely about stimulation. It is about creating a space where mind, body, and nervous system reconnect without pressure, guilt, or shame. Many men carry unrealistic expectations, believing that sessions must achieve a certain result or feel like they did in earlier decades. This can create unnecessary frustration. In truth, what you are experiencing is a different form of pleasure, slower, softer, and more attuned to presence than performance. Pause if tension builds, breathe through distractions, and accept satisfaction regardless of climax. This is not a race, a test, or a performance. It is a practice in reconnecting with the body and mind. It is also important to recognize when professional guidance is necessary. While many changes are natural, certain signs warrant medical attention. Persistent pain or discomfort despite lubrication may indicate inflammation, minor infection, or tissue irritation. Sudden numbness or significant reduction in sensation could signal a nerve-related issue. Difficulty achieving or maintaining an erection in calm, private settings may point to vascular or hormonal concerns. Emotional distress related to self-care, feelings of anxiety, frustration, or shame should not be ignored, as sexual and mental health are deeply intertwined. Consulting a urologist in these situations is a sign of commitment to health, not weakness. Even brief consultations can provide clarity, reassurance, and practical next steps. To start these conversations with a medical professional, consider a simple, direct approach. For example, you might say, "I've noticed changes in how my body responds during self-care. Is this part of normal aging, or should I monitor it more closely?" Providing details about dryness, sensitivity, loss of sensation, or changes in blood flow helps your provider give accurate, targeted advice. Experienced professionals understand these concerns and will respond respectfully, offering solutions that support both safety and satisfaction. Ultimately, self-touch after 60 is about moving forward with awareness rather than attempting to recreate past experiences. It is about discovering what continues to work, what brings pleasure, and how to maintain a meaningful connection with your body. Slowing the pace, loosening both physical and mental grip, and letting go of outdated definitions of success are all essential for achieving satisfying and safe sexual experiences. Pleasure at this stage of life is not only possible, it can be richer, more grounded, and more mindful than ever before. Your body is evolving, not broken, and it deserves care, adaptation, and respect. Even with proper technique, there is one often overlooked factor that affects prostate health, particularly for men who masturbate regularly. Most men are unaware of how self-touch habits can influence the prostate until complications arise. Staying informed and making small, evidence-based adjustments can prevent long-term issues. For example, understanding optimal pressure, frequency, and technique helps maintain prostate health and reduces irritation or inflammation. Integrating these practices ensures that sexual activity remains both safe and satisfying. Knowledge is power, and informed practices support not just sexual pleasure, but also overall health and well-being. In conclusion, masturbation after 60, or what I prefer to call intentional self-touch, is not about returning to previous methods, but evolving your approach with awareness and care. By adopting slower, gentler techniques, listening to the body, prioritizing lubrication, adjusting positioning, and maintaining a mindful mindset, men can continue to enjoy pleasurable experiences safely. Monitoring for warning signs, seeking professional guidance when necessary, and staying informed about prostate health ensures that sexual health is preserved well into later life. With patience, attention, and adaptation, pleasure after 60 can be deeper, more meaningful, and profoundly satisfying. Your body deserves evolution, your habits deserve adjustment, and your well-being deserves thoughtful attention.